Recently, at the Hackensack Medical Center in Hakimian Auditorium, took place a major annual forum titled Improving Healthcare in Armenia, Can the Diaspora Do Better? Sponsored by Armenian American Health Professionals Organization APO, the forum brought together a large group of medical professionals from US and Armenia representing diverse fields of medicine. A day-long forum started with the welcoming remarks by APO's President Larry Najarian, followed by one of the main organizers of the forum, Kim Hekimian's PhD short speech about history of the conference. Kim Hekimian is an assistant professor of nutrition and pediatrics at the Institute of Human Nutrition at Columbia University. Her first faculty position was the American University of Armenia's School of Public Health as an associate director of the MPH program and director of the Center for Health Service Research.
The history of this conference started in 2017 when we were asked locally by the ARF Drogomide to put together something about healthcare in Armenia. And we started our discussion with the title of the conference. I'm sorry about the slide. The title of the conference is The Good, the Bad, and the Ugly, the State of Armenia's Healthcare 25 Years After Independence. We had Dr. John Bilizikian speaking. We took advantage of the fact that Martui Petrosyan, who's the Dean of the School of Public Health of the AUA, she was visiting the US at that time. She spoke. Dr. Lucy Tovmasyan, who's an OBGYN here in New Jersey, who had done some work in Armenia, also spoke. And when Shant found out that we're having this local event, Shant said, okay, I'm going to be in the area. I'd love to come and talk as well. So we started with this description of our experiences in Armenia. And the result was that there was a lot of energy in the room, but we hadn't made any plans, really. Everybody described a little bit about what they were doing in Armenia. And the next year, we continued on this theme, but we decided to have a little bit of a discussion about moving away from humanitarian assistance to effective institution building, because we felt that after all the years of having spent really hundreds of millions of dollars in the healthcare sphere in Armenia, not much had changed on the population level. Not much had changed in indicators for mortality and morbidity, and we felt that we should talk about what does it mean to actually build capacity within the healthcare system in Armenia. And we had a plenary speaker, Dr. Haruchun Armenian, who was the former president of AUA, former dean of the School of Public Health at AUA, and also former dean of the Masters of Public Health program at Johns Hopkins. And that was on a Friday night, and Saturday the next day, many of you were here with us. We had people, the nonprofits that work in the health sphere from the Armenian diaspora gave a little bit of an example of what they do in Armenia.
The first speaker of the forum was Shant Shegerdimian, MD, MPH, Associate Professor of Surgery at UCLA with clinical areas of interest in neonatal surgery, pediatric trauma, and surgical oncology. Dr. Shegerdimian's topic discussion, titled Post-Revolution Armenia, Establishing Health Priorities, focused on overall healthcare needs of Armenia after the independence through today, post-Velvet Revolution.
I would say that the first 10 years after independence, our effectiveness curve, or our graph on the effectiveness, or our level on the effectiveness graph, was pretty high, because the situation was different. So in Armenia, there were humanitarian crises. There was the economic catastrophe of the breakdown of the Soviet Union. There were huge issues with the lack of healthcare professionals, lack of hospitals, lack of equipment. And that's where the diaspora could help. We were excited about having an independent Armenia, and we were well prepared to do the things that were required at that time: shipping supplies, building buildings, going over there and practicing medicine. We were also very well organized outside of Armenia, and so we were able to do these things quite effectively. But between years 10 and 20 after independence, the situation changed. Armenia began to develop open relations with the outside world, and there was stabilization of the healthcare system. There was emergencies. The lack of just simple things like Band-Aids and IV tubings were no longer as prevalent as they were during the first 10 years. And the healthcare system really transitioned from just barely keeping afloat after independence to focusing on strengthening and making the healthcare system sustainable. On the flip side, in the diaspora, we became disappointed with the bureaucracy and the corruption that permeated the healthcare system. The diaspora structures began to fragment, and the main sort of church structures, political parties became probably less relevant, and other people became more important players. And however, we didn't change, for the most part, the way we were contributing to healthcare in Armenia. We were still in the mindset of, why don't we get together, why don't we raise funds, why don't we largely build buildings or send medical supplies to Armenia? And all of this contributed to a significant decrease in our effectiveness. So here we are now, and we have a choice. Armenia has made the choice. They're on their way solidly towards further development, sustainability in the healthcare system. We have our choice in the diaspora. We can either continue to do what we're doing, but we have to recognize that we're not going to be effective anymore. In fact, we're going to be less and less effective. Or we can transform and change the way we think about contributing to healthcare in Armenia. Still remains relatively focused on the provision of short-term medical care or short-term training. We continue to build a lot of buildings and clinics and hospitals, and we continue to send a lot of supplies to Armenia. We remain fragmented. We don't have a coordinated way of approaching healthcare in Armenia. We continue to emphasize tertiary care. There's a number of us that go and practice very advanced surgical procedures, with a relatively fewer proportion of us going and addressing issues in primary care and pediatrics, and or in public health. We internally, and Sarah will talk about this later as well, are still working from the government side or from the ministry side, working on developing a set of priorities so that we have a roadmap of things that we can continue to, or start to address together. The fragmentation, not only in the diaspora, is geographically or within the different organizations that work in Armenia, but also even on the clinical or the medical side, we look at things sort of in our silo. So if I'm a surgeon, I think about the surgical aspect of cancer, but really the coordination of that care from the people that know something about screening to the people that know something about the pathology from the initial biopsy to us doing the surgery, then the oncologists, then the social workers. That spectrum is almost never defined in whatever we do from the diaspora side. The problems in Armenia and healthcare being along the lines of, oh, but we don't have enough hospitals, oh, but we don't have enough doctors. That's why our doctors need to go over there so that they can practice medicine, do the operations. But in fact, that's not the case at all. We have not a shortage of physicians in Armenia. We actually have more physicians in Armenia than the European average. There is a maldistribution, but that problem can be addressed internally. We don't need to necessarily go out there and do the actual clinical practice of medicine when there are plenty of healthcare providers in Armenia. Same thing with regards to the infrastructure. We actually have a surplus of hospitals as well as hospital beds. We're also training too many doctors through the medical school, and that surplus of trainees then becoming healthcare professionals is actually going to continue unless something is done. And really, when we look at Armenia objectively, we don't have a shortage of almost any medical sort of technology, the devices and whatnot. We have more MRIs per capita in Armenia than most European countries. So in fact, the emphasis has been too much on the technology and not enough on the primary care, on the medical education, and on the emphasis of using these technologies appropriately and effectively.
The forum continued on the topic of developing infrastructure to facilitate Armenia diaspora collaboration, with presentation by Sara Anjargolian, JD, representing Government of Armenia. Sara Anjargolian is the head of office and chief of staff at the Republic of Armenia's Office of High Commissioner for Diaspora Affairs, appointed by Prime Minister Nikol Pashinyan in June 2019. She serves with High Commissioner for Diaspora Affairs, Zare Sinanyan. Among other topics, discussed changes in ministerial structure in Armenia, specifically changes made to the Ministry of Armenian Diaspora.
I thought we would start with the actual structure of the government and where our office is. There is a lot of confusion about why the Ministry of Diaspora was closed. And just, I wanted you to see what the structure looks like. Now, I know this is a very small font, but basically you see all of the ministries, current ministries, in the bottom part of this slide. And in the top part is our office. So the Office of the High Commissioner for Diaspora Affairs is equal to a Deputy Prime Minister level. And the purpose of this thinking is that our office is going to be serving, if we can call it, kind of two constituencies. The diaspora, right? You are our constituency, and feeding into all of the various ministries. So today, for example, is a perfect example of what our office does. Connecting, for example, healthcare professionals in the diaspora with and aligning it with the needs of the Ministry of Health. In terms of our philosophy, we're being governed by the philosophy of creating a state-centered identity in the diaspora. So having be Armenianness and Armenian identity not be this sort of fuzzy concept, but very much connected to one's relationship with the state, with the country, and with the interaction one might have with the country. So this could be everything from, trips and tourism, all the way to repatriation, and obviously, with this group, sort of a professional relationship with the country. So this is what we're working on, is really shifting Armenian identity globally into a more state-centered identity. Repatriation is sometimes a scary word, so we're using something we're calling psychological repatriation. We're playing the long game here, right? This is a marathon. This is not going to be a short-term process for us. The work our office is doing is really on two fronts. It's psychological repatriation, right? Having people, as our Prime Minister beautifully says, live with Armenia, right? Aprel Hayastanov. So in your mentality, in your sort of heart and mind, to have Armenia at the center of it. And obviously we're going to be doing that with many layers of Armenian diaspora collaborations and programs, and not only us, obviously, way before the High Commissioner's Office was ever established. There's incredible programs that are already doing the important work of psychological repatriation. Birthright Armenia is one of them. I have 2 Birthright Armenia volunteers sitting in my office, one from Russia, one from the States. And the psychological repatriation that happens when a diaspora Armenian comes and volunteers, the impact of that can't be understated. Same with the trips that I was just talking to Alina Dorian about, the trip they're organizing with young people from Armenian schools. So this is all part of the process. And of course, then we also have physical repatriation, and we are seeing more and more, we're getting a lot more people wanting to repatriate. The #1 country now that we're getting repatriates from is actually Lebanon. And the obvious reason for that is the economic situation there. Obviously, in the past, we also had a high number of people from Syria, and I got an email a few weeks ago from Australia, and a lot from the States. So we are getting a lot more repatriation. I wouldn't say it's at a mass level yet, but we are getting a lot more interest in people wanting to move to Armenia. So what our office is trying to do with people who are interested in physically repatriating is offer a package of opportunities, right? So the Republic of Armenia is now saying, or will say, this is something that we have proposed to the government, it hasn't passed yet, that this is the package of opportunities that we can offer you if you're going to repatriate. So it's going to be everything from low interest loans for buying homes. If you can prove that you're a repatriate, then you'll get a lower interest loan. Small business grants, government of Armenia will match. If you put $10,000 or $20,000 into opening a small business, the government of Armenia will match that. Housing assistance, education assistance, healthcare assistance. So this is the package we're trying to create for people interested in repatriating. I will say that a lot of people don't need the help of the government. We have many people who have come and repatriated, and we haven't even heard from them. They haven't come through our office. So there's certainly also repatriation happening despite the opportunities and the structures that we're creating. Integration Center is another thing that we would like to create. Again, I will bring the Israeli model. They have a different model. It's called absorption centers, places where people will need to very quickly learn the language to be able to integrate into Israeli society. We're going to be creating a very similar model in Armenia. for kind of a one-stop shop. You've repatriated, you'd like to kind of know where to start. So we would assign you a caseworker, and that person would help you deal with the bureaucracy of moving to Armenia. So we're also in the process of writing a draft law on repatriation. So the Diaspora will have a draft law that will then hopefully be passed by Parliament. We're on the right track, where it will lay out the rights and responsibilities of people who are repatriating to the country. Again, Israel has something similar. It's called the Law of Return. I'm very excited about this because this is the first time, I think, in the history of the country that diaspora professionals are being invited to work in the government of Armenia. Our office has launched something called iGorts, and basically the idea is to invite diaspora professionals to come work inside of government institutions. The Republic of Armenia is going to be paying for this. In other words, we are financing for, at the moment, 20 people to come work in different institutions. So everything from the Ministry of Economy to our office, agriculture, healthcare, and all of the above. If you happen to have this one-pager, I invite you to look at what the priority areas are of the various, not just ministries, but also various committees and government structures. Before I came today, we asked about a week ago all of the various ministries to please list the type of diaspora professionals they would like to have. And I was pleasantly surprised with the specificity we got in some of these areas. So what's going to be happening now is we're going to be launching this, and we're going to be asking you to help us find these people. So everything from, if you look at the first one, sheep breeding specialists, right, all the way to Ministry of Health, which is looking for people, people to help with insurance policies, biochemists, people who know drone technology, and so on and so forth. So it's quite specific in terms of what the government needs. It remains to be seen, once we do find these professionals, how many of them are going to be willing to give us 6 months to a year of their lives, because we're asking people to actually come physically and be inside of these state institutions. So I'm very interested in your feedback on that during the question and answer.
Kim Hekimian asked the APOS president, ophthalmologist Dr. Larry Najarian, what Sarah Anjargolian's office, and therefore the government of Armenia, can provide to better assist the work APO is doing.
The question really is, how do we maximize the efforts and the resources of the efforts that want to take place? I think part of it is mentorship, helping people define what exactly they want to do. As so often is the case, people have a great idea, but that idea is always a lot better when it goes through a committee where people give their inputs and the idea becomes much more well-defined. The next question is, does that idea fit an actual need? Is there a demand for that idea? You can have a great idea, a great business plan, but if there's no market for it, then it's gonna fall on deaf ears. And I think that's one area that we can use some direction in. What exactly are the needs? What specific projects? What are the priorities coming from Armenia in the healthcare space that we can actually address in a meaningful way? The next is, what resources can we give those individuals to really succeed in that space? And that's what I find so intriguing about what Sarah was saying, that now there are some resources that are available. But resources are not just monetary resources, it's partnerships, strategic relationships that can make things work. Many of us have heard of projects that have taken place where partners were necessarily fulfilling their obligations on the other side, and as a consequence, the project failed. So we have to break down barriers to make things succeed. And yes, we have heard stories where equipment was sent and equipment was stuck in customs and sent back in pieces. So we hope that doesn't continue to occur. I myself was stopped in customs with medical supplies which were taken. Fortunately, they were given back. So I think we need to help our colleagues in that. But the other is something that I find really hard to wrap my head around, and it is a monumental undertaking, and that is to catalog all the activities in the medical space that are taking place throughout the world. I can guarantee that there is no one in the diaspora and there's no one in Armenia that knows of all of the activities that are taking place. Frequently we will talk with our contacts in Armenia and say, well, do you know of this project? And they're floored. They had no idea that that was taking place. And so often we are on a conversation with one of our colleagues from another organization. They say, I have this idea and I'm implementing it from the Boston area. And I said, well, we've been doing that for 10 years. And we look at each other and go like, wow, you know, why are we reduplicating our efforts when we can all do this in unison? So there is at this point no central database for all of the medical philanthropic activities that are taking place. As a consequence, we might find 3 or 4 different efforts trying to accomplish the same goal. And clearly, we'd be much better off if we were unified in our approach, working together, pooling our resources, pooling our talents to make these efforts a greater chance of success than any individual effort alone. So those are the biggest areas that I think we could get the most direction from. Some of ideas on how to do this would be that anyone doing any project in Armenia try to work through an existing organization. But even then, on a larger organizational scale, I can tell you there are projects being done by the Armenian General Benevolent Union, Judician Foundation, APO, that are reduplicating the wheel because we don't know what the other organizations just in the New York area are doing, let alone the whole country and then throughout the world. So I think a central database where every single activity that's being done by any organization needs to be registered with a central database and cross-referenced under a number of keywords so that if someone in the Midwest has this great idea of doing something, let's say, in the radiology space, they type in some keywords and they can find people of like mind to see if they can pool their talents and resources, and then cross-reference that and say, is there an identified need within Armenia for those efforts? So that's what keeps me up at night, is potential for failure. The dream is for all of us to work together with better communication to make those a greater chance of success.
The next speaker of the forum was Vigen Sepilian, MD, the founder and director of American Fertility Specialist Medical Group based in Los Angeles. He is a board certified in reproductive endocrinology and infertility, as well as obstetrics and gynecology. Dr. Sepilian has been an active member of Armenian American Medical Society, serving as president from 2009 to 2013. In his presentation, Dr. Sepilian spoke about the organization he is currently serving as president called AMIC, the quest of streamlining data and activities for all medical organizations working in Armenia for better results.
Standing in front of you here today as the president of an organization called AMIC, and Kim referred to it, and I'd like to say that AMIC is an organization of all of us that are here. So it's an organization that had its ideas conceived back in the 70s, in 1973, where there was the first Armenian Medical World Congress that took place in Beirut, Lebanon. That at the conclusion of that meeting, the idea was floated to have a pan-Armenian diasporan organization to connect healthcare professionals around the world with the aim of helping Armenia. So 11 years later in Montreal, as at the third Armenian Medical World Congress, this idea was taken a step further by the appointment of a committee whose job was to do a feasibility study and see if this could be done. And ultimately, in 1990, the Armenian Medical International Committee was formed, AMIC. So the purpose of AMIC really was to serve as a coordinating body and to link various diasporan organizations that were mostly professional societies comprised of healthcare professionals, and to help coordinate diasporan efforts in Armenia. Also, one of its main objectives of AMIC was to maintain a database of various projects that are taking place in Armenia for the exact purposes of Dr. Najarian mentioned, is to avoid duplications and redundancies, and to make sure that there are true robust communication for that to avoid redundancies. Now, just to give you an idea, AMIC has affiliated organizations in Amsterdam, in Australia, in Argentina, Beirut, Lebanon, Boston, several cities in Canada, Montreal, and Toronto. New York, New Jersey is one of the biggest affiliate organizations. Philadelphia, Ohio, Paris, Lyon, London, Los Angeles, Miami, Moscow, San Francisco, and Washington, D.C. So many of these affiliate organizations, some of them are small organizations, some of them are large organizations, some of them are multidisciplinary organizations, such as APO and the AAMS in Los Angeles, but some of them are specifically discipline specific, like the Armenian American Nursing Association, which is made of nurses. Now, if we look at what AMIC has done through the years, as it was created in 1990, it was at one point a very effective organization, especially in the era where Armenia was in its need for humanitarian assistance, also responding to various crises, whether it is the war or other issues where Armenia has needed some sort of assistance in healthcare. AMIC also had representation on the Ministry of Health, where there was AMIC had an employee that actually had an office at the ministry level and sat on the Ministry of Health.
One of the speakers was also Rafi Boladian, who spoke about the importance of involving the private sector into Armenia's healthcare system. Rafi Boladian is a seasoned strategic management consultant with over 10 years of experience in advertising senior government officials and corporate executives, in designing and implementing major strategic initiatives across the Middle East, Europe, and North America.
The challenge is basically when you have a country like Armenia, where you have a lot of help coming from outside, a lot of basically energy coming from the diaspora, what do you really need to take out of it and how do you funnel it? It's not the lack that basically is the problem, as we saw with the first presentation internally. It's channeling it that actually is the issue. And it's quite simple when you look at it theoretically, but you just need to make sure that you're aligning all of the stakeholders. And to do that, I agree, Kim, we need a database, but before that, we need basically a chaperone, someone to own that database and just literally use this tool to make sure that we're dealing with the situation. The challenges, I've quite tried to highlight a bit of the challenges I think we heard about this morning. And you have a lot of help coming from the outside. We all want to help, and we can only help in what we know what to do well. So if I'm a pharmacist, I go out in Armenia, I basically either intern in a pharmacy, set up a hospital, or set up a manufacturing site, and do what I know how to do well. And that's a good PR stunt for me as an Armenian from the diaspora, but it actually might not be the need that I have in the country at this point in time. So I've actually wasted a lot of my time, my efforts, my energy, and I haven't materialized in a better outcome for the country. And that would be very frustrating. So imagine multiplying that by 1 million, and you have all these Armenians going back and forth, flying back and forth, and we're not really realizing a better quality of outcome. So that is the biggest issue I think we have. And that, in my opinion, is what we need to look at in terms of basically aligning the simple demand and the supply. We need someone to tell us what they need, and we need to basically be channeled into that. There are a lot of ways to do them, and I'll talk about them in a minute. Second of all, I think what's more important than alignment is coming together. Because today, when we go to Armenia or any other country, we can only give so much, right? But if the efforts are not incremental, we're actually always going back to zero. And that's why when I went to Yerevan, I was quite surprised to see a lot of family care clinics, all of them doing the same thing, all of them being underutilized, but none of them actually coming together to basically serve a continuum of care. So you see a lot of people are actually offering a dental clinic, but they don't have a dentist. So why do I need another dental chair when I'm spending so much money? Let's come together and build something bigger and better. And I think the first presentation highlighted a huge problem that we are oversupplied, we're not underserved, we're overserved in Armenia today. The third issue, which I think is also very important, is the problem looking forward. We need to understand what the problems are, we need to tackle them. Our problems are very simple in Armenia. They start prevention, we'll talk about it in the afternoon, and they don't take much to do. So the challenges we're trying to look at here are really about looking at the bigger picture, ensuring that we're all coming together, and lastly, sustaining this. It's very, very easy and cheap to build. It's a great PR element. It's good for us. But how many centers have you seen that are not well maintained or well utilized in all of these countries? And this is not an issue about Armenia. This is everywhere.
The morning section of the forum concluded with informative Q&A, with questions on topics such as better organized conferences, the need for centralized database for diaspora projects, the current state of affairs in healthcare in Armenia, and much more. Afternoon section of the forum discussed the topic of focusing on quality healthcare in Armenia. The first presenter was Rodam Rostomian, MD MBA, who spoke about health education and disease prevention on clinical level in Armenia.
It's interesting. I've been visiting Armenia for almost 25 years now, and 20 years ago when I was in Armenia, 18 years ago when I was in Armenia, every time we talk about something new that we do in so-called West, they knew about it. They mastered it. They're the one who first did it, and then America kind of copied it. But things have really changed now. They are very eager to learn, and you will be surprised how eager they are to learn about quality, patient safety, and the performance improvement. And I'll just show you, and again, I just want to acknowledge Nune and Araxia, who helped us with this project. Nune is our Armenia-based director of the Armenian Eye Care Project, and Araxia was our project manager, which we couldn't have done any of this without their help. So we signed up our first cohort. We had 50 healthcare professionals. 27 of them completed and obtained their certificate. That's more than 50%. IHI's actually record is 22%. And then we signed up our second cohort last year. They just finished it in actually 2 weeks ago. They finished their courses. And another 50 people signed up, and 21% of them, 21 out of 50 were able to complete and get their basic certificate. And for the second cohort, as everybody mentioned, we decided to go to the MARSs, to the regions area, and even signed up people and the healthcare provider who were involved there. The key is they need to be proficient in English, but right now we're actually working on translating some of the modules online into Armenian for some of our colleagues who don't speak English. I just want to show you the sample of the medical center where we have presence in our first cohort of the 50, who almost 27 of them completed. That you can see there are people from Ministry of Health, Yerevan State Medical University, and many other clinics. One outcome of the first cohort was very interesting. I want to share with you. At the end of our first cohort, we sponsored 2 students from the Patient Safety Quality Improvement Project, and we took them with us to Orlando, Florida to attend the IHI's National Forum. And the students we wanted was Zana Davitian, who was actually a faculty in Yerevan State Medical University, and she was teaching about public health. And she did a research with her colleagues comparing the primary care practice in the MARS's region versus primary care practice in Yerevan. Where would you think there's a better outcome, in regions or in Yerevan, when it comes to primary care practice?
The next speaker, Dr. Gohar Zeitlian, focused on less discussed topic of quality of lab testing in Armenia. Dr. Zeitlian has an extensive experience in QA/QC field with strong background in clinical trials, CMP manufacturing of the clinical grade cell products, and in cell therapies. Currently, she works as a quality assurance manager, Center for Immune Cell Therapy at Memorial Sloan Kettering Cancer Center.
I've been in Yerevan, saw the labs. There is like a lot of improvement, but again, when it comes to documentation, when it comes to handling samples properly, there is a lot need to be done. Started from quality control of the training, building the system, who's checking those laboratories, how often they get audited, who are the auditors. I think in this case, there should be like I would say, system to build up, because there's nothing there. There is different when there is something, you start from there, but in lab quality, I haven't seen anything. Started from equipment. I've been in the lab in Hematology Oncology Center. It was beautiful. I saw some equipment that was amazing, and I was like, wow, you have this? How did you get this? And they explained somebody donated. I'm like, so how, like, can you show some results? Oh, we never used it. We don't know how to use it. So, okay, we get the money, we send the equipment, but then what? Do we train the people? Do we explain them how to use it, or the importance of that equipment? Memorial Sloan Kettering bought that equipment recently in my lab, and I remember going through the whole process of training and installing and everything. But what did they do? Nothing. And also, because I was involved in also stem cell cancer research and cord blood banking, they showed me the center where they do cord blood banking. It was amazing. It was the LN2 tanks and everything. It was beautiful. But that ends there. Like, when you start digging in, there's a lot of problems.
This section as well, followed by an engaged Q&A where the audience members asked several important questions to the panelists. After a short coffee break, the forum continued with the topic of medical education in Armenia, challenges and opportunities. The first speaker was Dr. John Belizikian, MD, who spoke about osteoporosis in Armenia, its diagnosis and treatment. Dr. Belizikian is Dorothy L. and Daniel H. Silberberg Professor of Medicine and Professor of Pharmacology at the College of Physicians and Surgeons, Columbia University, is Chief of the Division of Endocrinology and Director of Metabolic Bone Diseases Program at Columbia University Medical Center.
We want to continue to establish Armenia as a Eurasian center for education, training, research, and care. Infrastructure is the key to creativity and progress. If you think you can create a symphony without an infrastructure of music, forget it. Nothing gets done with goodwill. Forget it, you need money. And I have been very lucky to have been able to obtain the funds for this work, and this is some of the sources of my support. The last support item I want to mention, my grateful, very generous patients, not one of whom is Armenian. I have a lot of Armenian patients, but this money is coming from ODARs, who I can't stop talking about what I'm doing, and they say, I'd like to help you. And of course, support in kind. APO and these universities, we talked about a lot of these, the universities. The Hologic company has literally given me well over $1 million worth of equipment for DEX. So we can make a difference. It takes time to make that difference. It takes a lot of work to make a difference. But what is the difference? I think the difference here is an improvement in the skeletal health of the people of Armenia. And I really think there's no limit to what we can do one by one, but together also, to make education, research, and healthcare in Armenia the best it can be, and a model for the entire region.
The topic of Dr. Badalyan's presentation was women birth mortality in Armenia, training of qualified obstetricians, among others. Samuel Badalyan is a chief of Department of Obstetrics and Gynecology and Women's Health, Bassett Healthcare Network in New York, and is also a clinical professor of the Departments of Obstetrics and Gynecology and Urology at Upstate Medical University, State University of New York.
The most important thing for Armenians women's health care are, as you know, is maternal morbidity and mortality, abortions, STDs, and infertility. There is no guidelines about woman exams, and no any screening methods exist for cervical cancer, breast cancer screening, which means there are multiple problems and multiple ways to go. I'm going to show this slide because maternal mortality in Armenia is 25 out of 100,000 by WHO data. United States, it's a 14 out of 100,000. It's not better, but look at the Belarus, which old Soviet Union country, 6 out of 100,000, which means to be part of the old Soviet Union, it's not necessary to be problem. You know, that it's old Soviet Union republic, it's 6 out of 100,000, but just changing their health policies and how to make some changes, they were able to do better than United States, which means you spend so much money in US, but still your maternal mortality is significantly higher. So it's something to learn and something to think, what can be done? I realized that the skilled obstetrician and training MFMs are the biggest problem which Armenia doesn't have. They don't have doctors who know what needs to be done. And this is very important for Armenia because after analyzing all the data, looking the hospitals, looking all the emergency services possible, we realized that our graduate and postgraduate system are not adequate, which means they are not giving enough knowledge to the doctors, and programs are not strong. Residents spending 4 years to learn about OBGYN, and they're learning only how to write medical records. They are not learning how to do C-sections, not learning how to do hysterectomies, not to do any simple procedures. And those OBGYN residents finishing 4 years, and they're paying for that learning, and they now have to go to work. And they don't want to go in Marzer. We're asking why they not go to Marzer, because they're afraid to go in Marzer work, because they can kill people. They don't know how to operate. They don't know what to do. What you want? They're trying to work in Yerevan. They're paying bribes to be employed in Yerevan, and they're trying to learn something in Yerevan before they're going to go work anywhere else. And this is what's happening. All right, now how I can approach? And those people end up giving some kind of bad cases. And in Armenia, there is no malpractice lawsuit. There is a jail. If some patient die, they don't, they sue you, they put you in a jail, which means it's pretty serious. And imagine young 24, 25 years old graduating and doing C-section and hemorrhage, patient is dying, you may go in a jail. All right, this is the real situation. Which means you need to be really think about it, and need to be able to help those young physicians to become good doctors. We need less residents, but better training. Gabriel talked about it. I'm not going to go about the numbers. ACGME, it's significant. It's very important for us to create the system which exists in the United States, some structure which can supervise residency program and be able to control that. All right, this is the reason why in 2015, few of us came together and decided, let's think about how we're going to change medical education in Armenia. We created Arahet Foundation, which is Armenian Association for Health Education and Development. This foundation was created, Lorki is here, Lorki Libaridian, Shanche Kherdimian, Mialin Bagdasarian, and Ani Gilosian, who created this Arahet, which is specifically working on health education for young physicians and for residents.
A returning speaker from last year's conference, Dr. Lorki Libaridian, spoke about the importance of education for both patients as well as clinicians and healthcare professionals in Armenia. Lorki Libaridian works at Cambridge Health Alliance, where she sees patients of all ages, and is a medical director for performance improvement in primary care. Lorki is an instructor in medicine at Harvard Medical School and visiting assistant professor at Yerevan State Medical University.
So there's a couple of things that I'd like to have you walk away from this talk as the key points. One is that education is a key driver in health outcomes, right? It is not the only driver by any means, and we've heard a lot about that today, but it is a key outcome. So whether we're talking about patient level, the nurses, the clinical team, the resident, other providers, the doctor, the healthcare system, what's available on the internet, that education is absolutely key. And the healthcare delivery and the quality are linked to that. And then in the end, we are looking for outcomes, right? We're looking for health outcomes in the end. And that many different types of these initiatives that focus on health outcomes are going to include some form of medical education, whether it's direct at the levels we talked about or more supportive at the higher levels. And that, as in the US, there are frameworks and approaches that are accepted and evidence-based for medical education. We should be using those same approaches in Armenia so that we are able to measure our outcomes and measure our effectiveness learn from what's working, learn from what's not, go back and improve our systems. When we focus on, which is what we're focusing on in this presentation, the medical education of those providers, we need to make sure that what we are teaching is aligned with what patients need for those health outcomes. And when I think about my practice today, a lot of what I learned in med school and residency, I don't use. And a lot of what I absolutely need to help my patients and my community be healthy, I was never taught. So we need to make sure that when we are thinking about what we are teaching and how we are producing these curricula in Armenia, they need to be applicable, they need to be relevant, and they need to address the actual needs of the population in the context that they're in. So we were raised, many of us, maybe not the young folks anymore, but when we went to med school, we was taught that healthcare is predominantly by an individual practitioner. But this really isn't the case anymore. And in fact, this is just one model of how we can look at all of the factors that play into the outcome that we're looking for, which is the individual's health, the family's health, the community's health, the population's health. This is more relevant to, say, a US model, but you can imagine that in terms of English proficiency, you're talking about Armenian proficiency, or health literacy, you're talking about the understanding of illness, or the patient's educational level, or the patient's understanding of their own illness. You can think about, instead of learning new knowledge, you can think about learning new knowledge in Armenia, but also how to learn, how to be up to date, and how to make sure that what they are using and applying in Armenia is actually accurate and correct and be useful for their population.
The forum concluded with the topic titled Next Step. The final Q&A included passionate debate amongst the audience members on topics discussed during the forum. At the conclusion of this day-long forum, panelists and audience members alike gave ideas for topics to discuss in the next year's gathering. All ideas were presented in a written form on a large poster attached to a wall. While this important forum came to conclusion, the work of improving healthcare in Armenia continues, and it would require everyone's collective effort to make the changes needed to better serve healthcare needs of our country.